I want to give you some details about your upcoming surgery. It'll be at an outpatient surgery facility. We'll have you arrive about an hour before the surgery, and then you'll stay about an hour after the surgery in recovery, and then be able to go home after that. We'll want you to have an adult, trusted friend or family member that can take you home, and we typically recommend that somebody stay with you for about 24 hours after the surgery in case you need any help or have any problems as the anesthesia is coming out of your system. We will use dissolvable sutures to close up your incisions. We'll typically cover those up with some small bandages called steri strips. Those steri strips will peel off on their own about 2 weeks after the surgery. Try and leave them on until then. If they do start to peel up a little bit, you can trim off the edges, but try and leave those on for about 2 weeks to protect that incision. Some longer incisions will have some tails of the suture sticking out the ends. We'll trim those off when you come in for your follow-up, but try and leave those in place until then if you can. You'll have a dressing on your surgical site for about 2 days after surgery. Try and leave it on for 48 hours after surgery. At that point, you can actually take the dressing off and shower. You can let water run over the surgery site. We don't want you to submerge it for a couple of weeks, up to 4 weeks after surgery until the incisions are fully healed. But it's actually okay to shower 2 days after surgery and just let water run over it and pat it dry carefully. We'll have you start physical therapy about 1 week after surgery. We'll give you a prescription today, and we encourage you to start contacting them immediately to set something up for a week after surgery. If you wait until after surgery to set it up, sometimes the therapy office is booked out for a couple of weeks and it's hard to squeeze you in. So if you start working on that right away, it'll be a lot easier to get an appointment in a timely manner. We found that the patients that start their physical therapy about a week after surgery have a little quicker recovery and overall tend to do a little bit better after surgery. We'll have you not eat or drink anything for about 10 hours before the surgery. That includes water, coffee, milk. We don't want you to eat or drink anything. You need to come with an empty stomach. That'll make the anesthesia a lot safer. Now, if you need to take any medications the morning of surgery, you can do that with just sips of water. Don't drink milk or coffee. Once again, just some sips of water to get that medicine down. We'll go over your medications with you today. If you have any questions about what medicine you need to take the morning of surgery, we'll make sure we go over that with you today. As a general rule, we usually have you take any blood pressure medicine, thyroid medicine, or antidepressants with some sips of water the morning of surgery. Any medicines that you take at night, you can take those the night before surgery without any issues. We'll also go over any blood thinners that you're taking, and sometimes we'll have you stop blood thinners before surgery as well, but make sure we go over that with you today before you leave. I want to go over a few of the risks of surgery. Some of the most common risks that we worry about are infection, nerve damage, stiffness, re-tearing, anesthesia complications, and blood clots. Now, fortunately, those are all rare, but they do occasionally happen. We'll do our best to prevent all of those, but it still does happen on occasion, and we'll do our best if any of those do happen, we'll do our best to take care of you and try and minimize any effects of those. Even if the surgery goes well, even if you do everything in your power in your recovery, sometimes those things still happen, and we can't promise you there won't be any issues, but we'll do whatever we can to prevent those. We'll prescribe some pain medication for you to take after surgery. I'll send it in today, and then so you can pick it up ahead of time. Don't take it before your surgery, but you can start taking it after the surgery. Try and only take it for a few days after surgery. There's a lot of side effects and a lot of risks to this medicine, and so the less you take it, the better. As soon as your pain is under reasonably good control, we prefer that you switch over to Tylenol, ibuprofen, other over-the-counter medicines that don't have all the side effects of these narcotic pain medicines. One of the main issues we see with the narcotic pain medicine is it slows down your GI tract, and so you can get some bad constipation. So we also recommend you try an over-the-counter stool softener if you're taking narcotic pain medicine to reduce the effects of that constipation. After surgery, I typically like to see you back about 2 weeks after. We'll check on your incisions, we'll check on your range of motion, we'll make sure that things are healing up well and things are going well with therapy. But if you have any problems or any concerns before the 2 week mark, please feel free to call us. We're happy to address those with you. I hope this answers some of the questions that you have. Please let us know if you have any other questions, and we look forward to taking good care of you.